clear. So ideally we may Altered mental status, or AMS, is one of the most common calls you will run in the field. But here's the thing, altered mental status isn't a diagnosis, it's a symptom. Your job as an EMT isn't just to notice that your patient is confused, it's to figure out why. Today we're going to break down the systematic approach you need to stay organized when things get chaotic. First, let's talk about the baseline. You can't know someone is altered unless you know what normal looks like for them. Always ask the family or bystanders, is this how they normally act? If they say he isn't acting right, believe them, even if the patient is currently alert and oriented. Use your ALFPU scale for a quick check, but rely on the Glasgow Coma scale for trending. If that GCS score is dropping, your patient is crashing. When you walk into a room and find a confused patient, your brain is going to want to guess. Don't guess. Use the AEIU tips mnemonic to screen for causes. A is for alcohol. Check for odors or ataxia, anything related that could indicate this patient is intoxicated. E is epilepsy, and also for endocrine issues. Think postictal states or thyroid storms. I is insulin. Hypoglycemia is the #1 cause of altered mental status. Check that sugar. O is for overdose. Watch those pupils and respiratory rates. U is uremia or underperfusion. Is a patient in kidney failure? Are they in shock? T is for trauma or temperature. Check for head injuries or heat stroke. I is infection. In the elderly, a simple UTI or sepsis can look like a total mental breakdown. P is psychosis or poisoning. Don't forget carbon monoxide. S is stroke. Run your Cincinnati stroke scale immediately. Altered mental status has 2 main causes, structural or metabolic causes. For structural causes, these involve physical, plumbing, or hardware issues within the skull. The brain tissue is being compressed, torn, or deprived of blood flow in a specific area. Stroke, being ischemic or hemorrhagic, a blockage or a bleed, look for unilateral or one-sided deficits. Trauma, consider concussions, contusions, or intracranial hemorrhages, being subdural or epidural hematomas. Tumors, space-occupying lesions that increase intracranial pressure. Brain infection, being abscesses or localized swelling. Some of the metabolic causes. Metabolic causes are software or fuel issues. The brain structure might be fine, but the environment it swims in is toxic or lacking essential nutrients. These usually affect the entire brain globally. Hypoxia is a lack of oxygen, this is the most immediate metabolic threat. Hypoglycemia or hyperglycemia, the brain's only fuel is glucose. Too little and it shuts down. Too much, such as diabetic ketoacidosis, and the chemical shift causes profound altered mental status. Toxins or overdoses, being drugs, alcohol, or environmental poisonings, including carbon monoxide. Organ failure, liver failure leads up to ammonia buildup, or kidney failure, being uremia. Endocrine emergencies, consider adrenal crisis or severe thyroid storms. To make sense of all these causes, think of the brain like a computer. On one hand, you have structural causes. This is a hardware problem. Maybe there's a bleed, a tumor, or physical trauma from a car wreck. These often show up as focal signs, like one arm not moving or one pupil being blown. On the other hand, you have metabolic causes. This is a software or power problem. The hardware is fine, but the fuel is wrong. Maybe the blood sugar is too low, the oxygen is too thin, or the blood is full of toxins from kidney failure. Unlike structural issues, metabolic problems usually affect the whole brain at once, making the patient generally lethargic or confused across the board. As an EMT, your physical exam is the key to telling these two apart. Now let's talk priorities. Altered mental status patients are high priority patients. Don't get distracted by the why until you've secured the AEBCs. If they can't protect their airway, consider an OPA or NPA. If they're hypoventilating, which is common in overdoses, get the BVM out. And remember, glucose is a vital sign. Every single ultra-mental status patient gets a blood glucose check. If they are conscious enough to swallow and the sugar is low, administer oral glucose. If not, consider ALS backup. One final tip for the street: beware of the geriatric trap. In older adults, altered mental status might be the only sign of a life-threatening condition. A 20-year-old with a UTI feels pain. An 80-year-old with UTI gets profoundly confused. Never dismiss confusion in the elderly as just old age. It's an emergency until proven otherwise. So in conclusion, stay systematic, use your mnemonics, and always treat the patient, not just the monitor.